I am Dr. Hari Prasad, a neurologist working in Ahmedabad Institute of Medical Science and Research Center, Kochi. I am going to tell about patient Mr. Ravindran. Mr. Ravindran is a 45-year-old man. He is suffering from a chronic neurodegenerative disorder. The exact diagnosis is still not clear. Initially, he presented with progressive cognitive decline, refractory seizures, and dystonia and chorea. And for the last 3 to 4 years, he is bedridden and almost in vegetative state. We have done extensive workup, including the genetic screening like TNR sequencing, and still the diagnosis is not clear. But his seizures are fairly under control with antiepileptics, and his movement disorders are also under control. And now he continues to be in vegetative state. Depends on the cultural sensitivity. Many times we change the antibiotics, and yet the ulcer continues to grow in bigger size, and always there will be foul smelling discharge from the ulcer with a deep, thick, yellowish slough. So after almost trying for 6 months, we lost hope for controlling this bed sore from our system of management, and the economic burden caused by the care of this bed sore was so enormous for the relatives. So patient was discharged from our primary care. The patient was sent back to their home, and from the house patient was seen by an Ayurvedic physician, and he started his own mode of treatment. And I am very frank to give my exact opinion that after his treatment, around about 1 to 1.5 months, the bed sore really started reducing in the size. Healthy granulation tissue has grown, the foul smelling discharges disappeared, and the yellowish slough also has gone. And now the width of the ulcer as well as the depth of the ulcer is significantly reduced.
Can you be a little more specific about the changes in terms of, there are many wounds on the patient's body. So, what exactly are the changes? Is it one, the pus discharge has been reduced, and then the granulation tissue
has grown up.
So, would you say it is really now brought under control?
Well, he has got 3 ulcers. The ulcer on the right side of the gluteal region is fairly under control, and there is no discharge, only healthy dry granulation tissue is there.
Has it reduced in size?
Yeah, it has significantly reduced in size, and the skin also actually started growing from the sides. There is no doubt about that. About that bigger ulcer, of course, previously there are a lot of discharges, pus used to ooze out from that very foul smelling pus. That has significantly come down, but it is not as healthy and dry as that ulcer on the right side.
So, normally is this an expected outcome? Medically, from the point of view of modern medicine, what would have been the prognosis?
Actually, from modern medicine, we consulted with general surgeons, and even they consulted with the plastic surgeons, and almost all of them opined that even a flap surgery is out of question here because of his extensive wound, and
skin transplant was out of the question.
They said even the skin grafting is out of the question, because always when we do the cultural sensitivity, it is always used to be positive, and almost the bone is seen, all the sacral bones were seen. So they said
bones are not visible.
Bone is not visible now.
Normally, because there's always this attitude, that there are also conditions which might get cured by factors other than medicine. And Ayurvedic treatment most often gets dismissed as spontaneous remission.
That's true.
Or self-limiting. Would you say that this condition would fall under any of those categories of spontaneous remission or self-limiting?
As far as this wound is concerned, I am really surprised. I never expect that this much a remarkable difference will be. I am basically a person very much skeptical about Ayurvedic medicine. But after seeing this, I am really confused. That's what I say. I don't know what has happened. But
he has given only internal medication.
He has given only internal
There
medicine.
has been no dressing.
Yeah, no dressing, nothing. All.
But are you continuing modern medications for that?
We are the basic dressing what we used to do in the hospital we are doing, like cleaning with the betadine and applying this metrogel gel and dressing.
The
That's all.
patient is not on any antibiotics.
No, not on any antibiotics.
Only the Vaidyas.
Yeah, only by this treatment.